Hello, welcome to our webinar today. My name is Dr. Erick Bingham. I'm a board-certified chiropractic physician. Today's topic is going to be on peripheral neuropathy, and we're going to talk about how Calmare treatment treats peripheral neuropathy, what peripheral neuropathy is, the cause of it, and some options for you. You know, it's one of the common things we treat in our office, and so we're excited to be able to see if we can help more people with this type of condition. So first of all, I'd like to start off maybe what peripheral neuropathy is. And peripheral neuropathy is basically a result from nerve damage. It causes weakness and numbness and pain in the hands and feet. A lot of people describe it as almost wearing like a stocking or a glove on your hand. And it's very painful, very uncomfortable. A lot of people describe the symptoms as being, you know, an onset of numbness and tingling in the hands and feet, burning sensation, jabbing, electrical-like type pain. They'll even have skin and nail and hair changes on their feet and on your hands, lack of coordination, or they're just not able to move and use their hands and feet as much as they would like. And a lot of people describe it as like they don't like heat. I've had patients come in that describe they love walking on cold tile or keeping their feet out of the covers at night. They just don't like anything touching their feet whatsoever. Very painful condition and difficult to sometimes even diagnose as far as what the cause is. And so that's the next thing we'll talk about is what are some of the causes of it. And it can be difficult to pinpoint some of those factors, but I'll go over a few of those that I think are common. One of them is alcoholism. You know, with alcoholism, it creates a poor dietary choice for people, so that leads to vitamin deficiencies, and that can lead to neuropathies. There's autoimmune diseases out there, like lupus and rheumatoid arthritis, Guillain-Barré syndrome, chronic inflammatory conditions. Number one, I think, would be like diabetes. A lot of people know about peripheral neuropathy associated with diabetes. I would say half of the people with diabetes is going to get some type of neuropathy in their hands and feet. And one thing with that, when we do treat the neuropathy in our office, we want people to have their diabetes under control. And so that's one thing we can talk to you about when you come in. Other common things are medications. Chemotherapy is a huge one. I would say 40% of the people that do chemotherapy are going to get some type of neuropathy in their hands and feet. They're doing studies at the Mayo Clinic and the Massey Cancer Center with the Calmare treatment and treating the pain associated with the chemo drugs and having some fantastic results with it. Other ones could be trauma, car accidents, sports injuries can cause severe peripheral nerve damage. Tumors and cancers can cause it, and even vitamin deficiencies. Some common ones would be B1, B6, and B12. Those are common ones that cause, you know, if you have a deficiency in those are crucial for nerve type of health. So I encourage you to make sure that your symptoms are that you're taking those vitamins to help with those symptoms. So the next thing that we would do is, you know, is finding the diagnosis, you know, and the way that usually your medical doctor or whoever you go to, they're going to do a full medical history on you. They're going to do neurological evaluations and physical exam. And our goal is to find out the cause. If we can find the cause and treat it and get rid of it, you know, that's the best option. But in some cases, there's no solution. You know, once there's been that nerve damage, then there's no way to fix it. So all we can do at that point is actually just treat the symptoms and help the symptoms feel better. And so that's where I'll talk about, you know, the treatments associated with neuropathy. probably the main thing that if you went to your medical doctor or neurologist, they're going to give you some medications, typically anti-seizure medications. They found that like Lyrica, gabapentin, Neurontin, it's just a very difficult thing to treat with neuropathy. Nerve pain is not controlled very well with opiate or narcotic type of medications, and so they found that like Topamax and Lyrica, gabapentin, Neurontin, they help a little bit. It's kind of the only option that medically they have to be able to treat and help with those symptoms. But there's been a new breakthrough with this Calmare therapy, that it's a new FDA cleared device that treats neuropathic pain. And we've had some phenomenal results with it. I've never seen anything work as well as this does. Those medications, they help a little bit, but nothing compared to what this Calmare therapy does. And we've just had some great success with it. I would say 80% of the people we see, get phenomenal results. What's nice about it is we can usually find out from that first treatment if it is something that will probably help them. It's a series of 10 treatments that a patient will go through on average. But that first treatment, we're looking for pain relief. If we don't get any pain relief, then you're probably not a good candidate for this type of therapy. But when a patient comes in, we do a full workup on them, physical evaluation, a medical history, and physical exam, and to see if they are a good candidate for this type of therapy. And I had a patient last week that came in. She's been suffering with peripheral neuropathy for 14 years. She had tried everything from medications to nerve blocks to acupuncture to creams, you name it, she's tried it. And she had heard about us and was skeptical just because nothing really seemed to work for her. But we were able to get her completely out of pain. And that's a common story that we hear with a lot of patients that come in here. And we'd love to help anybody that's interested. So, if you want to contact us, just give me a call. Our contact information is on the screen. You can give us a call at 801-922-4310, or you can look at our webpage, UtahValleyPainRelief.com, or even Facebook. So, there's a lot of ways to try to find out about us. And when you contact us, we'll be able to kind of talk to you over the phone and see if you are a candidate. And we offer a free evaluation, free treatment on the first treatment to see if you are a good candidate. So really, you have nothing to lose. So give us a call. Thanks for joining us on the webinar.